thank you for this invitation. I'm really honored to be talking to this group and getting the chance to talk to you all. As was introduced, I'm a child psychiatrist here at Washington University. I have a research program that focuses on chain differences in brain development associated with kids that go on to develop problems with anxiety. And then I have a clinic at WashU that is specifically focused on treating kids with anxiety disorders. Um, I'm going to talk today just really generally about the types of anxiety and what it looks like in kids generally. Of course, individuals that have Chiari malformation have higher rates of anxiety, but usually the approach that we take when we're evaluating or trying to help someone is similar. And so hopefully I think this will be sort of a useful sort of foray into that. But please, anyone jump in, or I think there'll be questions in the chat because I'd like to make this helpful for people. So please feel free to divert me or ask questions along whatever way you'd like. So I always, whenever I talk to folks, I like to just start off by just making sure we're on the same page as far as definitions, because people can mean a lot of different things when they use a word like anxiety. And as a child psychiatrist, when I'm seeing a kid for the first time, I'm looking for different types of anxiety or what their anxiety looks like. And so the first thing to say is that anxiety disorders are a group of related disorders that share a few common things. Of course, there has to be like excessive fear, so being scared of something that's in front of you, or anxiety that's worrisome, like you're worrying about something in the future. And it's normal to have some level of anxiety or fear. Of course, it's an important human emotion, and so we say that it becomes a problem or it's a disorder if it's causing a problem in the person's life. And for most people, that looks like avoidance. So people tend to avoid whatever it is that they're scared of. But it can have other ways that it shows up. A lot of people will become very angry or have outbursts in situations where they're anxious, or they have a lot of distress. So they kind of grin and bear it. But these are sort of the common elements of all types of anxiety. And then the next thing that I wanted to do, and just because I think it's really important when you're thinking about someone that might have anxiety, it actually is really important to potentially think about what kind of anxiety they have. And so I'm going to talk about the 3 or 4 most common types of anxiety problems that come to clinical attention in children. And so the first is separation anxiety. So these are people that have fear whenever they are separated from a caregiver or from someone they care about, that specifically that something bad is going to happen to them or something bad is going to happen to their caregiver. So a kid might worry if they're separated from their parents that the kid's going to get kidnapped or the parent's going to get into a car accident. This can happen at home, so someone won't want to be in a room by themselves. They might not sleep in their own room, or might have a lot of nightmares, might have a problem going to school. But the theme is always that something bad is going to happen to them or to a loved one. The second type of anxiety that commonly comes to clinical attention is social anxiety. So these are situation. In this case, the fear is negative evaluation from other people. So, and the most common way this comes up are then people that are shy. So they feel nervous about introducing themselves, talking to other people. But social anxiety can show in a lot of other ways as well. A lot of times in sports, for example. So people that have high social anxiety, they might not want to participate in group sports or individual sports because they feel like people are watching them or judging them. Obviously, giving a presentation in front of the class or professionally or whatever it is. But again, the worry is other people are thinking something bad about me, and so it's causing me problems in at least one particular situation. And then the third type of anxiety problem that commonly comes to clinical attention is called generalized anxiety. And so these are people that are always worrying about something in the future. So the first two are more about fear. So fear of separation, fear of social situations. This is really more about anxiety. So just imagining what could go wrong in the future, and it could be anything. It could be, are we going to get someplace in time? Did I bring the right things? What's the weather going to be like? But it's future oriented, and it's sort of nebulous because it can attach to anything. And a lot of times, people that are sort of caregivers or friends or parents of people with generalized anxiety find themselves constantly reassuring that person, potentially that kid, that because once they feel better about something, their worry switches to something else. So it's more about a process of worry than it is about one thing in particular. And then the other type, the actually the most common type of anxiety is actually what's called specific phobia. So being scared of something in particular, and that could be fear of strangers, fear of flying, fear of heights, fear of needles, or sometimes fear of say like medical situation. And it's the same idea as everything else that I'm going to talk about today in terms of the other three types of anxiety disorders. I just don't have a slide. But again, I think it's really important if you think you might have anxiety or you know someone that might have anxiety to think about which types of categories they might fall into, because it really does help us think about what's going to be useful for that person in terms of helping them and coming up with a treatment plan. A few other just kind of general uh, educational pieces that I always like to make is anxiety is extremely common. So it's the most common form of mental health problem, and it's the most common form of mental health problem at every age. So it depends how we measure it and how we ask questions or how we go about it. This study put the rate at about 30% of people in their life experience some level of impairing anxiety. That exact number changes from study to study, but however we measure it, it's always the most common, more common than depression, ADHD, or certainly more rare things. And even more so if for people that have other psychiatric or medical health problems. And so the numbers would be even higher for people that have other kinds of, again, medical problems. So lots of people are struggling with anxiety. The next point that I like to make is that for most people that have a problem with anxiety, it starts when they're very young. So the median age of onset of an anxiety disorder is about 6 to 8 years of age. So that means that half of all people that in their life will ever have a problem with anxiety had that problem or had a problem with anxiety by the time they were about 8. So just to say that if you are seeing someone that is that young that has anxiety, it's common because that's often when it starts, and then it can be persistent or take other forms as the person gets older. So the exact type of anxiety that a person has may switch. So when they're younger, they may have separation anxiety, and then social phobia as they get a little bit older, and then maybe generalized anxiety as they become an adult, or they may get different specific phobias. So the exact manifestation may change, but the idea is that for most people, it starts very young, and so we that makes us think that whatever it is probably something that's happening with the brain from a very young age. And in fact, even before 6 or 8 years of age, we can see symptoms in 1 and 2 and 3 year olds that aren't perfect, but they help us predict a little bit who's likely to have a problem with anxiety later in life because those infants are more shy or they get really sort of startled or activated by something that's new or different. If they see a stranger, if they get put into a new room or something like that. And even those early warning signs when you're very young are predictive of later anxiety. So again, seems to be some early neurodevelopmental thing that predisposes people towards anxiety. The next point that I want to make is that for most people that have a problem with anxiety, it's persistent. That is, that they pretty much always have some level of symptoms of anxiety. Certainly, it can get worse in certain situations. Like if they are going to go into that situation, they usually should get nervous in that situation. And that's different from other kinds of mental health problems that we treat as psychiatrists. So things like depression, which is also a very common mental health problem, is what we call episodic. So people with depression, they will have a week, a couple weeks, months where they're very sad, or they don't enjoy things as much as normal, or they're really irritable. or have other sorts of changes in their mood. And those mood problems can be very problematic. But for many people, they'll have episodes that will last that time, and then it could go all the way just all on its own for months or years, and then come back again. So other mental health problems can kind of have this ebb and flow, but anxiety tends to be more persistent. And the reason that I bring that up is that for people that like suddenly have anxiety that they never had before, we want to make sure that there's not something else going on, that there's not a stressor, that the person isn't being bullied or has some other interpersonal problem, something is going on at home, that then you'd suddenly see the increase in the symptoms. Okay, so those are the general points that I like to make, and then the other thing that I like to remind people or let people know is that for most people that have anxiety, or for many people that have anxiety, it's also common that they might have another mental health problem like ADHD or depression or something. So anytime we see a kid with or someone with one of those with an anxiety problem, we also want to see if something else like that is going on. And then, although most people that, or most kids that have a problem with anxiety, although most of them do really well when they're adults, a kid that has a problem with anxiety is more likely than their peers to have a problem with depression, substance use problems, or other mental health problems when they're an adult. So what we hope is that if we can help people at all ages, right, or when they're young, is that maybe we can help prevent some of that other stuff that might come later on. Okay, so now I want to sort of just very briefly go over what we do to help people with anxiety, and I'm going to focus on kids here, but the evidence is the same for adults. So I'm also I spend most of my time doing research studies, again, studying brain development with anxiety. So I always go back to the science to try to help figure out how I can help my patients. And I'm not going to go into the details of the study, but the results of how to help people that have a clinically significant anxiety, and that's true. We have less evidence for people that have other neurological problems, say, but by and large, these same results hold up. And that is that medicine and therapy are both effective for people with anxiety. And they're better than it's like a sugar pill or doing nothing. So in this study that I'm showing here, kids that were started on just a medicine or just had therapy were doing better. 60% were doing better 3 months later. And that was better than the 25% of kids were doing better that got no treatment. But then the combination is better than either one alone. So medicine plus therapy is more effective than just getting medicine or just getting therapy. And in this study and many other studies, therapy and medicine appear to be about equally effective. I'm not going to go into the details of the method that we typically use unless people sort of want to ask a question about that. I don't know how useful that would be, but typically these are medicines like SSRIs, the medicines that you take once a day and that you show symptom improvement over weeks and months rather than medicines that immediately make the anxiety go away, like a benzodiazepine or something. So I know there's going to be another sort of talk that goes into detail about some ways in which the anxiety can be managed therapeutically. But I just want to emphasize that therapy is extremely important for people with anxiety. And there's lots of different types of therapy that you can get. So saying that you're getting therapy is sort of the same as saying you're getting a medicine, which means it's not very specific. There are different recipes that the therapist is following. And there's many different approaches, but at least in the kids that I see, the most effect or the most research points towards using what's called cognitive behavioral therapy with exposure, CBT with exposure as is having, again, just the most evidence, the most number of studies that support it. And so for people that are at the point where they feel like they want to get help for themselves or for somebody else with anxiety and they want to go a therapeutic route, I always recommend that they specifically ask whether or not the person does CBT, and again, especially with the exposure part. So again, I'm just going to just briefly touch on this because I know there's going to be a longer discussion, but the idea behind exposure therapy is that whatever it is that makes the person anxious or scared, And this is why it's important to know if they have separation anxiety or social phobia or some specific phobia. The idea is to find how like scary things seem to them on a scale of 1 to 10, and find different situations that sort of make them a little bit nervous or moderate level of nervous or very high levels of anxiety, and then gradually have the person intentionally put themselves into those situations, but starting with the easy stuff, the ones and the twos, and then week to week, sort of building up to the higher stuff. And this can also be true for more specific phobias like fear of doctors or needles or something like that, where you can gradually get the person there in sort of a behavioral way. And so tends to be really important for people with anxiety. Okay, I'm not going to spend again a lot of time on this slide because again, there's going to be another talk about this, but it's just sort of emphasizing that a way to help a person with anxiety is sort of building off of what we do in therapy, which is getting them to be sort of mindful, as we'll hear about, in terms of their thoughts, feelings, and body sensations when they're having these anxious, and then seeing if you can come up with a way of gradually exposing them to whatever it is that makes them anxious. All right, and then I just would be remiss if I didn't say that, again, we always want to understand everything that's going on in a person's life. So if we're trying to help someone with anxiety, we also want to think about other medical problems that the person has, other psychiatric problems, how everybody else around them is doing. So if a parent is struggling, it's really hard for us to help a kid get better. Stressors that are happening at home or with peers are really important. So if someone's being bullied and they don't want to go to school, that's not an anxiety disorder. That's just being scared of an actual threat. Okay. And then I was asked to also kind of also talk a little bit about some of the research that we do. So I'm just going to kind of briefly give sort of a high level view of some of the work that we've done. This is how I spend most of my time. Um, so I think about sort of brain function at the level of what's called a network, which are just like large parts of the brain that are working together to do something specific. So in this slide here on the left here, I'm working on something, and so I'm there's a lot of activity in a network that is called the frontal parietal network, but it just helps me pay attention to what it is that I want to pay attention to. And then this person in the next slide, this person is calling my name, so I redirect my attention towards him. And a different set of brain regions then have higher activity. In this case, it's the ventral attention network. So you need this other network to sort of suddenly change your attention if something happens, like your name gets called, or an alarm goes off, or there's some other salient thing that you need to respond to. And so it's the what your focus of attention is sort of a balance between these brain networks that are involved in directing your attention where you want to, but then also being able to shift your attention if something comes up that you need to pay attention to that you weren't thinking about before. And so my lab has done, amongst other things, some work looking at these sort of how attention works in people that are anxious and how these brain systems work in kids that are anxious. And what we've found is that adults and kids that are anxious and that have these anxiety disorders that I mentioned earlier, they have sort of a overactive ventral attention network. That is, their attention is more readily shifted or more quickly shifted to things that are unexpected or different. So like if a loud noise goes off or there's a flash or something. So we think that maybe part of the challenge and maybe part of the reason why someone is anxious is because there's a disbalance between how their attention is focused. So it's harder for them to just stay locked in on what they're doing and instead get shifted to something that then they might interpret as scary or wrong or bad in some way. And so in this study, we just showed that the more anxious a kid was, the higher activity they had in this brain network, the teal here, the ventral attention network, that redirects your attention to things that are unexpected or different. And I don't want to make too much out of this, but just to kind of show you the direction that we're trying to take some of this work is seeing if we can then help the person by maybe correcting this difference, by retraining their attention or by retraining this brain network. So decreasing the amount of activity that happens in this brain network when something unexpected or different happens, so that the person can stay locked in on what they're doing and not get distracted by things that then they're going to potentially think of as scary. So the details here aren't super important, but we came up with this sort of simple computer game that kids could play for about a half an hour a day, twice a week for a month, where they had to pay attention to a part of the screen based on where this arrow was pointing. And eventually they were going to just have to make a simple decision about something that happened wherever they were paying attention. But they had to ignore, while they were doing that, they had to ignore all these other things that were happening on the screen and hold their attention at that one place so that they could be accurate when they had to make a decision about something that appeared there. And so the idea was by just practicing paying attention, right, in one spot and learning to have to ignore all this other stuff that was going on. And in fact, they had to keep their eyes in the middle of the screen. So if they moved their eyes and looked at anything, the screen went blank and they had to start over. So they really had to learn how to stay focused on something and ignore something else. And so this was an early study. We only had 18 kids in this. It was not, there was no control. They were coming into our lab, so they expected that they would get better. But we had them do this. We found that their brain activity in this network that we said we thought was problematic, the ventral attention network, went down. So we feel like we changed their attention and we changed the activity in their brain, and then their anxiety got dramatically better over the course of the training, especially early on. Again, I don't want to make too much of a big deal out of this because it's not a controlled study, so I wouldn't like recommend that people get this right now. I think it's better to do therapy and medicine, the tried and true stuff. But just to give you all a sense of the type of work that we're doing, how we're trying to understand how the brain might be functioning differently in kids and adults that have anxiety, and then how we can actually leverage that into new treatments. So I will stop there. And it was like sort of a very quick version of sort of the discussions that I normally lead. So definitely happy to clarify anything or on any of the stuff that's useful.
Excellent. I think we can take a couple of questions, if there are any. I know I have one to start us off, if anything. Um, so you mentioned, the differences between social anxiety and generalized anxiety. I guess a good question for, especially for parents, is how do you identify that in a child necessarily? What's the difference between, anxiety versus typical distraction? Or just actual fear of something, and then what does it look like, and then when do you recommend seeing a professional as opposed to managing it on your own?
Yeah, those are great questions. So, um, I'll take the last one maybe first. So, as far as when do you think it's when should you get help or when should you do something? I don't think it's super important to um, create a magic line and say you have a you have a disorder or you don't. I mean, sometimes we have to do that for practical reasons, but I think that if the simple answer is if it's getting in your way in some way. So if the child doesn't have as many friends as they'd like, if they aren't participating as many sports as they would like to, if they're not going to school, or if they're distressed a lot, if it's causing any sort of way where it's getting in their way, then it's at least worth doing something. And that might be talking to your pediatrician, that might be working with a therapist, or that might be something even just more simple like following some of the tenets that I had on that other slide, or getting a book about helping your kid with anxiety. Because a lot of the therapeutic interventions or the simple things you can do, like the gradual exposure, are going to be helpful no matter what, right? No matter what level of anxiety the person has and whether or not they go into a disorder. As far as knowing sort of what type of a problem that a kid might have, if there's any question, it makes sense to talk to a professional that can sort of direct the conversations that would help get at that, because it sometimes can be difficult. You brought up at the end sort of being distracted, right? So sometimes kids that have ADHD and have anxiety, sometimes it can get really complicated to know if, say, they're nervous about taking a test because they have performance anxiety or social anxiety versus they're not very focused and just in general. And so usually what we're doing is we're looking for patterns across multiple different environments where the same types of problems are coming up, because then we think, okay, then it's probably falling into this category than another. So I don't know if that answers all of your questions. It is, but it's something that we just take a lot of time and try to sort through.
Yeah, it was pretty heavy loaded. Sorry about that. And I'm gonna preemptively ask this one because I know I get this a lot. as far as the medications are concerned, I know a lot of parents have a lot of, um, hesitancy, I guess, because they're a little worried about, short versus long-term effects of SSRIs, things like that. So, is there anything that you would say to their, efficacy and safety and all that?
Yeah. So, so SSRIs, right? So the category that we use they're very effective for children with anxiety disorders. Um, they and I showed in the previous slide, but there's a lot of work to suggest that they're equally effective as therapy, at least in the studies that they use both of them. Uh, the there are most kids tolerate the class that we use without any side effects. The most common side effect would be sort of a little bit of maybe sick to your stomach or a little bit of headache when you first start the medicine. It's relatively rare for kids to have long-term side effects from SSRIs, and if it happens, you can just stop the medicine, and it goes away. In fact, in meta-analyses, the only thing that's more common than a sugar pill, specifically for kids that have a problem with anxiety, is something called activation, which is just like a kind of like a rambunctious energy that can be too much. There's a black box warning on SSRIs for kids for increased thinking about suicide, which sometimes come up. So first of all, that has never been shown in kids that only have a problem with anxiety. Those were studies that included kids with depression, which is a separate thing. And then the data from some of those studies were that there were very low rates overall of thinking about suicide, and there was never any actual suicide attempt or completed suicide or anything like that. So SSRIs are a very safe, can be very efficacious medicine. Obviously, you should talk with your physician, about this because everybody is different. And the other thing I like to, flip a little bit on its head is that, the studies that we have when kids are treated for their anxiety, their brains look more sort of like typical, we'll say, or more like kids that don't have anxiety after treatment, and that including with SSRIs. We also know that kids with anxiety can have a lot of problems if it's severe, right? They can have other mental health problems later on. They can be less likely to get a job. They can be less likely to have meaningful peer relationships. So all this just to say is it's not benign to grow up with anxiety your whole life. Like there's also a risk of having anxiety and not having it treated. So it's not really just what are the risks and benefits of taking the medicine or not taking it. It's what's the risks and benefits of taking the medicine and potentially having your anxiety better versus not taking a medicine and maybe it doesn't get better, or what the other options are. So it's an important question, and a long one, but obviously, I feel pretty strongly that these medicines help a lot of people.
Absolutely. And we do have time for one more. It just came through. So this is a question perfect for you, actually, because it's in the scientific realm. Or maybe we could do one more. We'll see. Um, Patients who have difficulty metabolizing these types of medications. So, um, what would you recommend for alternative options? This person mentions stabilizing microglia. I'm not sure how that would work, but what are the alternatives to medications if they're not necessarily um, tolerating the medicine, I guess, for lack of a
Yeah.
better.
Yeah, it's a great question, and there's a lot to unpack there, many different facets of this. I mean, we sometimes, if we have a kid that will have a hard time with several medications, we can send out a genetic panel, which will tell us, at least give us some information about which medicines the person may metabolize better or worse, and then that be based on the enzymes in their liver and what their liver breaks down. And so that can help us sort of like either find a medicine that they do metabolize okay, or potentially adjust the dose based on what the results are saying. And it can go either way. You can be a fast or a slow metabolizer. Um, as far as, I mean, obviously there are other non-medicine treatments for anxiety, which again are very important. Medicines and therapy are equally effective. So therapy is a very good option for everyone, including people that can't tolerate medicines. As far as other options, other types of medicines, um, There are studies out there that show some initial evidence for things like that, but it's early on, and sometimes you see big results like that hold up, and other times you don't. And so I'm reluctant to sort of wholeheartedly endorse anything else. There have been negative studies of something called like Buspar or Buspirone, which is a medicine that's used to treat adults with anxiety. That the benzodiazepines like Valium or Xanax or something actually can make kids more likely to have depression. So unfortunately, we can't just always take adults medicines that work in adults and apply them to kids. And so those are the main medicines are SSRIs and then SNRIs, which would be like duloxetine, Cymbalta, venlafaxine, Effexor, things like that are the two main classes that have been well studied in kids. So.
I'm going to squeeze one more in really quickly, just because it's pertinent to specifically to medical and like health anxiety. So you talked about CBT medications and exposure therapy, but any ideas on different paths to help if, typical treatments aren't working necessarily and they still have all that fear, and you don't necessarily want to, put them in an MRI or make them go to the ER. So how do you handle that when it seems to be persistent?
I mean, that's tricky. And obviously this is a situation where you would want to develop a relationship with a therapist or someone, another provider that can really dig in what specifically is happening in those situations. But I do think that, you can get pretty creative with exposures because now we have YouTube, so you can watch a video of all sorts of things. Or, I do MRIs in kids. So we use MRI to study brain development in kids. We have lots of kids that are nervous about getting an MRI. We have a mock scanner setup where they get in like this, essentially like this cardboard tube, and we play loud noises and do other sorts of things. So it might be hard to do those things, and you have to decide if it's worth it, right? Because it depends on how often they're going to get an MRI. Like if it's going to happen once every 5 years, then that might be a case where you just give the person something to calm them down immediately because it's like a one-off acute situation. But if it's something that they're going to be doing regularly, like if they're going to be going to the ER a lot or MRIs a lot, then it might be worth trying to think creatively with a therapist about exposures.
Awesome. Thank you so much, Professor.